I remember when I started my job 17 years ago, there was already some people who were interested in health economy and who made a study on how much is a portion of, strictly speaking, healthcare costs and how much is outside of that, more in the direction of social care and other indirect costs, such as the loss of taxes, the delay of people going into pension when they are still working, and what the drugs could influence or other therapies could influence. So I don't think that there is a major change in this relation. The figures might be different, but the cost is obviously much higher today of the therapies and the strict medical costs than 15 years ago. But the relation to the social costs and related costs is more or less the same. So my recommendation towards patient organizations who want to do active lobbying and influencing of their government would be to use the study to raise awareness, first of all, mainly of the burden of disease, but also on the costs of disease, and what I mentioned earlier, the differentiation between real medical costs and much higher other costs. So that is one point, but starting from there, you need to ensure that the government understands the value of data, now demonstrated by 17,000 patient sets, and much more important for the future is not a snapshot like this one here, but a continued collection of data. In order to do so, there is a twofold approach useful. One is concentrate on the data which you use on national level in your country. They might be in part different from what, for example, EMA or later on INETA will require. And this is the job of a project which we currently started, the MS Data Alliance, to harmonize a minimal data set which should be implemented in all registries, MS registries in Europe, in order to have a data set which allows to pool certain relevant data, relevant for EMA, relevant for INETA, relevant for researchers, and relevant for patient advocates. So this is a big job to define data which are covering the needs of those four groups and implement them in our registries. What is done on top or beside is absolutely the business of each individual registry and country.